One of the major epidemics of the world today is to do with intracellular glucose metabolism and insulin resistance, and the effects thereof of uncontrolled blood glucose levels. Diabetes mellitus is a dietary lifestyle metabolic disease that can be controlled with the right support and mindset. One of the best investments you can make is in the investment of your metabolic health. True Essence is one such investment, and I would like to thank True Essence for sponsoring today's podcast. True Essence is a top supplement company in Malaysia, formulated by a group of healthcare professionals with the belief that everyone deserves premium yet affordable supplements. Jinmilon Plus is a supplement crafted with natural ingredients that specifically target blood sugar control. First, it contains Folium Gymnema sylvestris extract. It's also known as the sugar destroyer. It helps to reduce sugar cravings and supports healthy insulin levels, making it easier to manage blood sugar spikes. Second, there's Fructose Mamodica charantia or bitter melon extract. This ingredient mimics insulin in the body, promoting better glucose uptake by your cells and helping to lower blood sugar levels naturally. It also has Cortex Cinnamomum cassia presil or cinnamon extract. Now, cinnamon is well known for its ability to improve insulin sensitivity and enhance glucose metabolism, helping your body use sugar more effectively. Lastly, Semen Fasciolus vulgaris or white kidney bean extract, which is a natural carb blocker. It inhibits the digestion of starch, reducing the amount of sugar released into your bloodstream after meals. Each of these ingredients work synergistically to help you maintain better blood sugar control and reduce the risks of complications. Take charge of your metabolic health today with science-backed support. With Jinmilon Plus, you get a powerful 3-in-1 solution to maintaining better blood sugar levels. Number one, it blocks carbohydrate absorption. Number two, it burns excess sugar. And thirdly, enhances insulin sensitivity for better blood sugar management. If you would like to try Jinmilon Plus, go to trueessence.com.my/Jinmilon-plus and mention the code in capital letters Charles Jin for a discount today. Do it today. You will save yourself a lot of problems in metabolic disease.
No, but that is probably a bad thing, right? Because they're not actually getting the warning sign unless they're going to check their fasting insulin. They will never know, right? And we see this in the hospital all the time where somebody comes in, it's usually a man, but sometimes it's a woman, and they come in with an awful heart attack or a stroke. And then the spouse is there saying, oh my goodness, like he was never sick. He was working, he was doing fine, he was totally normal, doing everything, right? And then we do all the lab work and we find all these abnormalities, especially things like high triglycerides and maybe the pressure is high. So all these things, abnormalities we pick up, but because their body was very well compensated on the outside, they never knew, right? And if you're eating what everyone else is eating, you know, these things, depending on your genetics, right, these things can be creeping up and happening behind the scenes, right? So that's why pre-diabetes, that term is very misleading, falsely reassuring as well, because a pre-diabetic has the very, 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 very same problem as a type 2 diabetic, which, by the way, when these medications came out, Ozempic and so on and so forth, people getting upset that overweight people were using these medications. And I said, look, I mean, overweight people have the same root problem, which is insulin resistance, as a type 2 diabetic. And so if you're going to take a medication that is going to help in some way, right, at least temporarily until you can do the things, you know, lifestyle, right, but it's getting at that root cause, which is shared. It's a spectrum. It's like a continuum, right? So obesity, pre-diabetes, even high blood pressure, high triglycerides, fatty liver, all those things share the same root cause, which is your insulin is not working properly. It's too high. And then you can have insulin high because it's high enough to squash the sugar down, right? But it's working super hard and eventually it can falter. It fails. And this is when we see people coming in with a bad heart attack on awful stroke, and they're basically hanging on for life in ICU because now after a while your body cannot contain everything, anymore. It can't contain it.
So insulin seems to be the real the trigger that kind of keeps the whole thing on a cascade, one after the other. And so, I mean, this is godsend. I love talking to you. I wish I was your neighbor. I mean.
Your concerns matter. Join plastic surgeon Dr. Charles Lee on Heart Talk.
We can redirect our behavior to food and change the future of our health. But I've said for many years, you cannot change what you do not know. And I've struggled with that because everybody tells you to change. Well, how do you change when you do not know how and when and what to do? Now, I'm interested today that I've got an excellent guest with me today, and she comes all the way from the States, but more about Dr. Amina. Her name is Dr. Amina Goodwin. And the topic that we're going to talk about is something that is so important to stay alive when it comes to longevity, when it comes to health, when it comes to metabolic health in particular. It's all about glucose. And the mirror image of that glucose is the name insulin. So if you've got these two in your pocket, you're set for life. Now, one of the major epidemics that has really been rigged this whole world is because of our food and what we take in. And I'm a cripple to that because I've struggled with sugar. I'm like an addict. And instead of losing weight, I seem to be putting it all in. And so today I've got a solution that's going to bless all of us today. And so this is Dr. Amina Goodwin-Fernandez, but she's an infectious diseases specialist, in particular on diabetes. And so without further ado, join me to welcome Dr. Amina to Heart Talk. Welcome, Dr. Amina.
Thank you so much, Charles, for having me. It's a pleasure to be here. And thanks to your listening audience for watching, of course. And like you said, I am here. My passion is helping diabetics. I'm an infectious disease physician, but first I'm an internal medicine physician. So I take care of the whole person, the whole adult person. And that's actually very important for an infectious disease specialist because we have to know, okay, is it an infection or is it not? Now, I got into the whole diabetes. My interest in diabetes came because at least half of my patients for infections are diabetic at any one point in time. They have serious blood sugar problems. So that's how I got into that. And what is my mission now, right? Other than helping to take care of sick people in the hospital with bad infections, I feel it's my mission now to help people prevent those bad infections. So help them before they get to the hospital, specifically frustrated diabetics who are just sick and tired of the same old, and they want a different way. And my way of helping them is not with the traditional prescription medications and so on, but to help more with diet and lifestyle changes, which are pretty simple. And that is through my 4-part B.E.A.M blueprint. It's a simple framework that takes into consideration what the individual can do, right, without needing a prescription or permission from somebody else. And it does supplement what they might be doing with their doctor, prescription medications and so on, but it also helps them to be able to not need more medications and hopefully need less, if not no medications in the future. So that's kind of what I do. Yeah.
And this is the secret to having a lovely life, living it free and healthy.
Yes.
And so let me start off the bat by congratulating you on your book, Beaming Health.
Thank you.
I think that I always talk about radiance in my field as a plastic surgeon, and then I always say that if radiance is not personal, you have not reached that place that you want to be, and so if you're not beaming with health, you're just living life day by day without really knowing what the source is all about.
Indeed.
Now, so you're talking to me now live from Mississippi, right?
Yes, I'm in Mississippi. For those who might be aware of different accents, my accent is an Eastern Caribbean one. So I'm originally from a little island in the Eastern Caribbean called Antigua. It's a twin island state, Antigua, Barbuda. But my island is Antigua, 108 square miles, about 90,000 people. and it's a former British colony. And in these Eastern Caribbean islands, the big income earner was sugarcane plantations for the British state. But anyway, sugar is a big part of the island and of island living, Caribbean living. And so I have a lot of experience as a person. I know you have mentioned to me about your issue with sugar addiction, and I've personally experienced the same just from my upbringing on a country where sugar was a big part of life.
I know. I mean, you know, Antigua, sugarcane country. I mean, we have sugarcane here too, at least in Asia, in this part of the world. And you know, there's used to be this saying, water, water everywhere, not a drop to drink.
Yeah.
And you grew up in this country, and I was reading part of your book, and it says that, you know, you're telling your mom, I cannot live without sugar. I mean,
Yes.
this seemed to be your daily on the table kind of food.
Yeah, it was serious. It was serious. It's probably worse for me, I would say, than the average person, because I literally was so bad that I felt like I couldn't, if I was drinking anything, it had to be sweet. So I never drank water as a child growing up, and even coming up, graduating from medical school. And so my parents, they were like, and even when I met my husband, they thought it was so strange and almost scary that, hey, you're a doctor, but you don't drink water, right? And I just felt like I just needed that sweet taste, and I needed tons and tons of teaspoons of sugar in my tea, in my coffee. I always had sweet biscuits, and I just really needed all that sugar. So I identify with your feeling that, oh my goodness, like I'm addicted to sugar and I can't see how I can get from taking all that sugar, right? But, you know, for me, and we can get into that later on if we want, but basically it comes to a point sometimes, hopefully before it's too late, one comes to a point where they realize, oh my, actually, maybe this is a problem, right? And maybe I do need to figure it out, right? But you're never going to get to that point until it becomes really important for you to actually figure it out.
You know, there's this song, Breaking Up is Hard to Do, by Neil Sedaka. You know, I remember doing that. And I think one of the biggest difficulties in life, apart from breaking up relationships, is breaking up with sugar. You know, I mean, when did you realize that you were, if I can use the words, addicted to sugar?
I was addicted. I was.
When did you realize that, hey, you had to break up with this thing? Because, I mean, I'm struggling with that even till today. And you can read all the books, you can listen to all the podcasts, but at the end of the day, you know, it's a whole brain event to break up with sugar. When did that happen to you?
So I think for me, the main thing, I came here into Mississippi. So I have been in Mississippi since 2013 from the Caribbean, just to work and, you know, get the experience and all. And here is where I really started to realize how bad complications from excess sugar were, right? Now, we're trained traditionally that there's a lot of genetic, right, hereditary. So I thought, okay, well, in my family, no one has diabetes. And then I thought, we're trained also that if you're overweight, only then you have to worry about things like diabetes, right? But of course, when you practice medicine and you see, hey, like there are people of all sizes who have diabetes, right? And so seeing the impact of diabetes, seeing it's not necessarily about obesity, I started to think, well, maybe this could catch up with me eventually, right? And then also for me, one of the things was hearing myself speak to my patients and then having a bottle of something sweet on me, because I always had a bottle of juice in my pocket. So just the realization that, hey, I'm being a hypocrite. And there was that one point in time too when a patient actually, I felt like he looked down at my sweet drink in my pocket while I was telling him that he needed to cut his sweet drinks. Okay. So just that kind of contradiction in my behavior. And then at around that time too, my husband shared it with me because he was always getting me to trying to get me to use that sugar. So there's a guideline that came up from the World Health Organization that no one, whether diabetic or not, should have more than 6 teaspoons of sugar in a day, right? So the fact that they had a guideline, which 6 teaspoons is the same as 24 grams for people looking at a label. But I thought at the time that, hey, the fact that a guideline exists and it's for all of us, not just a diabetic, maybe there's a reason why it's limited for all of us, right? And so that made me start looking into it and reading and getting more information, right? And I think one of the times when it really kind of clicked is when I read one of Dr. Mark Hyman's books, because he writes a lot of books about this. And in that book, there was just a small section early on which talked about how excess sugar even if you're not diabetic, it causes diabetes, yes, but it causes a whole bunch of problems, including female-related problems like polycystic ovaries and fertility issues, right? And that's something that I had struggled with. And it kind of clicked in me that, oh my goodness, like, okay, yeah, I'm not diabetic, it doesn't run in my family, but oh my, there are other problems, right, that kind of arise from excess sugar and what it does to your whole system. And you mentioned insulin, I believe, earlier, and just everything together is tied in. And if your sugar balance is off, then your whole body's off. And so that started the whole learning process for me, right, with sugar, learning for myself and then also for my patients, because I felt, okay, well, if my patients are struggling, and well, I'm struggling in this field, in this area as well, in terms of consumption, maybe what I learn for myself will help my patients as well, because I always want to help my patients get better and not need me anymore. So it's all that together. And then just slowly but surely, I, decided, first thing I did was decided, okay, this is something I need to do. And so I just basically gradually, some people cut sugar cold turkey, but I started by weaning myself off, diluting sweetened drinks, using less and less sugar in my sweetened beverages. And once I realized, going back to sweet things and realizing that, the taste buds can be retrained. This doesn't taste too good anymore, right? It's syrupy sweet, or it's sickeningly sweet. And just getting to the point where I didn't want it anymore. And then the more you learn and the more you change and you feel better and feel more energized, the more changes you make. So a lot of times you might think, I need to do everything perfect from day one. From the moment I make a decision to change or to do better, it needs to be perfect from that moment in time. But for me, I realized that, okay, it's a gradual process. And then if you have support, somebody supporting you along the way, and it's gradual, you feel the better, you feel the advantages, and it gives you momentum to keep going. And you just learn and learn. And the more you learn and realize how bad the alternative is, the more it makes you want to keep going and, just being healthy. That's kind of what it was.
Excellent. So, let's untie this, because I find that there's so much that we kind of know. It's like walking into a smoking zone and a non-smoking zone. You know that the smoking zone is unhealthy, and yet when you go to the shop and you see people buying, and they got all those packets of cigarettes, and they've all got lung cancer and everything is there, and yet they will buy the packet of cigarettes and smoke. Same with us in life. I mean, this is no good, and yet you go and buy that blooming bar of chocolate. You know what I mean? And so let's just unpack this, because you are a specialist. This is your field. And people are getting more and more. I mean, I myself am getting more and more educated when I hear some of these podcasts and YouTube and all that about sugar, especially belly fat, and how do you control this and all that. So let's talk a bit about the pathology and maybe go into the pathophysiology. There are a lot of terms that are swung out in the YouTubes and all the people who talk about this. Glucose, sugar, fructose, sucrose, and then fat comes in, and then energy. There's a lot that's bandwagoned all over the place. So take us on a step now. When you talk about, to me, look, this is something we can control, Amina. It's a dietary disease. It's not something like cancer or something that, that you can't, it's just picked up. But this is something that you and I can control. So let's start off right there from why is it so? I mean, how many people go and check their bloods to find out whether they're problematic or not? What's the normal blood glucose level? And how many people really do that?
So most people are not going to check their blood sugar level. Okay. I mean, the normal, above 70 to about 120, ideal, right? Stable level, right? Most people are not going to check. Okay. So if you feel great on a day-to-day basis, you have lots of energy, nice stable energy, your mind is clear, you're not having frequent cravings for something sweet, you're not feeling very sluggish and sleepy after every meal, and most likely your energy level is stable, right? And just to go back a little bit, sugar or glucose is basically an energy source for your body, okay? So it keeps everything running, your cells thrive on it. It's one of the main energy sources. Others would be fat or fatty acids, and then protein or amino acids, right? But sugar is like a nice quick source of energy, right? That gives you a quick burst. Your protein will kind of take a little while, a little longer to kick in, right? To give you energy, but it lasts quite a bit longer. And then fat also takes a while to kick in for energy, but it really smolders on and lasts a nice long time. So those three nutrients together, we have 3 nutrients in nature because they serve different purposes and they are able to spread out energy for different periods of time, right? So if you have sugar, right, that's kind of a way when I tell you about, feeling sluggish or sleepy or cravings, that's an idea that, oh, maybe your sugars are kind of up and down throughout the day. Maybe when you eat your meals, your sugar goes high, and that's why you're feeling tired. Because if your sugar is high in your bloodstream, okay, it means that it's not going into your cells. So your cells are sluggish, and that gives you that tired feeling. That's one of the reasons why you might feel tired. So it's floating around, which is why diabetes is classically known as starvation in the midst of plenty. You have a lot of energy there floating around in your system, but it's not getting to the cells, okay? Now, eventually it does get to the cells, but maybe after overcoming the hump of bringing that high sugar level down, it plummets and goes a bit on the low side. And so again, you're stuck having low energy, right? Because you went from one extreme to the next, and in that low, which could be compared to the high, so it might not be abnormally or dangerously low, but just compared to how high it dropped and how sudden it was, that is kind of a shock or an abnormality for your body. And so you feel tired and sluggish and foggy and achy and so on. So those are some of the feelings or symptoms that you might experience, and it's usually related to meals, timing of meals. And then some people might notice that they feel these fluctuating energy levels more when they have sweetened things or a lot of starchy foods and less of the fat or the protein mixed in with the starchy foods. So that gives you an idea of what's going on, right? Now, you have sugar, and to explain exactly, because we're going to stick with sugar because that's kind of what, the problem is with lack of energy, right?
Sure.
So if you think about, you have the audience understand what goes on with sugar, right? So if you think of a kitchen sink and you have the pipe or the faucet, right? So faucet normally would let water into the kitchen sink. Think of the water as sugar, right? And the kitchen sink is basically the blood vessels, right? Your system, right? And so your sugar is coming in, or the water is coming through into the kitchen sink, right? And then you have the drain, which essentially is like the water going out, but in this case, it's the sugar going out into the substance of your body, okay? Now, insulin is a hormone which is responsible for guiding the sugar out of your blood and into the substance of the body, basically all the cells of your body. Insulin has to channel that sugar through the drain. But if the sink is full and there's lots of sugar in the sink, then you're going to need lots of insulin to guide it out through the drain and into the substance of your body. Insulin is a bulky guy. So if you have lots of insulin channeling all that sugar, it's going to clog your drain up. Right? If your drain, the more clogged, it might be partially clogged and gradually more clogged. But basically, if your drain gets a little clogged, but your faucet is still pouring lots of water into your drain, then eventually it's going to overflow. It's going to spill over. And that overflow of the sugar, water, from the system out of the sink is what is diabetes, right? Or pre-diabetes, or just disease in general. So if you bear that in mind, then to control this overflow, which is too high blood sugar, what you need to do, right? Several things. You can turn down the faucet so you have less of the sugar coming into your drain, less water, less sugar coming into the system and collecting in your sink, okay? Or you can, so you turn it down or turn it off or turn it down, or you can still have sugar come in, but you put a sort of sieve, right? Something with holes, you know what I mean, right? So you can have a wide open pipe, or you can put a sieve to slow down the water so it comes to more of a trickle, right? So if you have a sieve, right, which in this case of the body, your sieve would be like your fiber or your protein or your fat, right? These things kind of spread out the sugar bits, right? They make the sugar particles or sugar molecules kind of far apart, and the sugar has to sort of bump and jostle around to get past these barriers, right? Which in this case is a sieve, then trickle into your bloodstream, and then it can be slowly released, right? Or you can have a bit of a suction system underneath or beneath the drain, which basically is your body. So have your body using up more of that sugar, right? So it's sucking more of the sugar. As the sugar comes in, your body's sucking it through the drain. And that is your muscles and your organs and just your healthy body in general, your activity, that you're using the sugar as it's coming in. So it's not building up in the sink, it's not overflowing and causing disease, right? So that essentially is what is going on and how you can see problems arising, okay? And that blocked drain, right? Blocked, clogged up with insulin, that is what insulin resistance is, when it just can't do its work anymore because it's just blocked. So that's a way that, you know, you might find understandable, or the audience.
This is really good. So breaking it into further piecemeals, right?
Mm-hmm.
Now, insulin is regarded as the energy hormone.
It enables you to use the energy that's there. So insulin takes your sugar. If you don't have insulin, right? So people like type 1 diabetics who don't have insulin because the pancreas is damaged for whatever reason, right? Those cells, so they cannot get sugar into their body, right? And even insulin helps sugar mainly, but also to an extent, some protein is taken into cells by insulin. Fat doesn't need insulin, but there's a bit of help with protein. And like I said, obviously glucose. So if you don't have insulin, the cells don't get energy and you starve. So that's why type 1 diabetics will be losing weight. They're eating, but they're losing weight because they have no ability to get that energy. So that's what insulin is needed for.
So it doesn't, right. So it doesn't have any effect on fat, because I thought fat is also, you know, insulin helps get the fat in too for energy.
No,
it was an
minimally.
energy
Yeah, it's negligible. So actually, type 1 diabetics back 100 years ago, before insulin was discovered, they basically were fed fat. They were on a high-fat diet because that's basically what they could have without needing insulin to take it into their cells.
So talk to us some more about this insulin resistance, because that's the key. That's the cornerstone.
Yeah.
That's what's happening at the bottom line, because, you know, why are people putting on weight? Or why is obesity coming in? Where is this food being stored? Because at the end of the day, you want to give that glucose transduction right through the cell into the mitochondria, where all the energy and the ATP is being released.
Exactly.
So insulin resistance, take us there.
So insulin resistance can occur from several reasons. So and this is type 2 diabetes, right? So essentially you have sugar going up really quickly, okay, sugar in your blood, glucose in your blood going up quickly, but also it's staying up for too long, okay?
Right.
So the more sugar stays up, the higher it goes, and the longer it stays up, it means that your body is going to be consistent or continuously getting the signal that, hey, we need to bring sugar down, so make more insulin. So it's telling the pancreas, hey, sugar is still high, so let's make more insulin to bring the sugar down, okay? But then we said that eventually, when you have so much insulin in your system, it's going to clog the system up. And eventually, the cells are bombarded so much by all this insulin that they're like, okay, like we need to lock this out because like we're going to blow up, we're going to explode, we can't take any more energy anymore. And so they lock the channels that insulin would need to put sugar into the cell so that the mitochondria, the powerhouse of the cell, can get the ingredients it needs to make the energy, right? So the cells get locked up, the channel gets locked up, insulin cannot get in, so sugar is high, it stays high, it goes high again. So there's even more of a signal to the pancreas, make more insulin because the sugar is still high, and it's a vicious cycle, okay? Insulin stops working. So the problem number one is too much sugar in the system. Too much sugar in the system means that you're making more insulin, right? But then more insulin means that you're going to have a resistance. The body's going to shut off the channels of insulin. So solving problem number one, too much sugar. To solve that problem, make insulin, right? But then you make insulin and then insulin stops working. So solving problem number one causes problem number two. And then you're stuck now, your sugar is always high, insulin cannot get in because the channels are blocked, and you're just not feeling well. The cells, the mitochondria, they get some energy, but they're not getting it on a regular, efficient basis, right? It's a sluggish process. And so you're just not feeling well. And ultimately, so in terms of insulin now, you're chronically now with high insulin in your system, right? Insulin causes a whole different set of problems. So insulin is good because it helps your cells get the energy that they need so they can do whatever they need to do and you can stay alive, right? But then if you have an excess of insulin floating around in your system now, that is constantly telling your body, okay, we're in storage mode. We need to put away, we need to store. So we need to store all this excess energy as fat, right? And even if you don't have any energy, because okay, it finally comes down, but your insulin lags, like the decrease in your insulin takes a longer time, right? And so you have it still in your system, even when you're in the fasting state, and it's blocking your ability to burn fat. So you're in the fasting state, but your insulin hasn't come down yet, right? So now it's blocked. You can't burn fat. So you keep the excess fat, especially belly fat, right? Fat, excess fat in your liver, okay? And then insulin causes other issues as well. It causes, like eventually you can have some problems with stiffening of your vessels. It causes your kidneys to hold fluid and salt. So your pressure goes up between the stiffening of your vessels and holding on to more water and salt. Your pressure goes up, you have swelling of your legs, and then insulin, it's like a pro-growth chemical, a pro-growth hormone. So we talked about how it makes you put on weight, makes you store fat, but it can also tell tumors to grow. So some cancers are stimulated by insulin. So as much as we know about diabetes, but we're learning more and more about how having high insulin and insulin resistance promotes the development of breast cancer, colon cancer, liver cancer, lung cancer, not lung cancer, right? Colon cancer, I said, right? Ovarian cancer, potentially, right? And then also in the ovaries, it causes like the stimulation of cysts, right? So that goes to the polycystic ovarian syndrome that I mentioned briefly before, right? Where it causes overproduction of certain chemicals and then overgrowth of cysts, and there's an imbalance in the female hormones, right? So all these downstream problems just because insulin is staying high in the system. And that's really why we're seeing so many of these different lifestyle diseases. And then, you go on to the heart disease and the stroke risk and so on and so forth.
One of the major epidemics of the world today is to do with intracellular glucose metabolism and insulin resistance, and the effects thereof of uncontrolled blood glucose levels. Diabetes mellitus is a dietary, lifestyle, metabolic disease that can be controlled with the right support and mindset. One of the best investments you can make is in the investment of your metabolic health. True Essence is one such investment, and I would like to thank True Essence for sponsoring today's podcast. True Essence is a top supplement company in Malaysia, formulated by a group of healthcare professionals with the belief that everyone deserves premium yet affordable supplements. Jinmilon Plus is a supplement crafted with natural ingredients that specifically target blood sugar control. First, it contains Folium Gymnema sylvestris extract. It's also known as the sugar destroyer. It helps to reduce sugar cravings and supports healthy insulin levels, making it easier to manage blood sugar spikes. Second, there is Fructose Mamodica charantia or bitter melon extract. This ingredient mimics insulin in the body, promoting better glucose uptake by your cells and helping to lower blood sugar levels naturally. It also has Cortex Cinnamomum cassia presil or cinnamon extract. Now, cinnamon is well known for its ability to improve insulin sensitivity and enhance glucose metabolism, helping your body use sugar more effectively. Lastly, Semen Fasciolus vulgaris or white kidney bean extract, which is a natural carb blocker. It inhibits the digestion of starch, reducing the amount of sugar released into your bloodstream after meals. Each of these ingredients work synergistically to help you maintain better blood sugar control and reduce the risks of complications. Take charge of your metabolic health today with science-backed support. With Jinmilon Plus, you get a powerful 3-in-1 solution to maintaining better blood sugar levels. Number one, it blocks carbohydrate absorption. Number two, it burns excess sugar. And thirdly, enhances insulin sensitivity for better blood sugar management. If you would like to try Jinmilon Plus, go to trueessence.com.my/Jinmilon-Plus and mention the code in capital letters Charles Jin for a discount today. Do it today. You will save yourself a lot of problems in metabolic disease. Yeah, well, this is really this is good for those who are listening in. This is a call sign. And that call sign, Amina, is to get the insulin down.
Yes.
That's a
Yes.
call sign.
Yeah, or some might say it's an early warning signal, right?
Yeah.
So it's like the first thing you're going to see. So before you even see your sugar high, right? Because in the beginning, when those insulin levels are, when insulin is working over time to bring your sugar down, it does get the sugar down, but it's working really, really hard. So if you're checking, and some people experience this where they kind of don't feel right and they sort of feel like they have diabetes. Sometimes they urinate frequently because maybe the sugar does go above the limit where it spills into the urine, right? But then they're having dips, right? So it would drop, okay, and then by the morning too, it might be normal in a fasting state. And if they check one of the common blood tests, which is a hemoglobin A1C, which really gives you an average of your blood sugar levels over a 3-month period, that might be normal, but it's normal because it's an average. Meanwhile, throughout the day, week after week, you're having highs and lows, right? And so your average is perfectly normal, right? So if you check the fasting insulin, which is not a common test, and certainly in America, the insurance a lot of times is not going to pay for it. So I've been telling people, look, just go and check, go and pay for it yourself, right? And you just need one time. Just do it once to see where you are. And this is where in a fasting state, so usually in the morning, because you would have hopefully not eaten anything for 8 hours, you get this. And if you're in the fasting state, that insulin is high, it's not supposed to be high because you didn't eat anything. There should be nothing for it in your blood, no high levels in the bloodstream for it to store away. I mean, you always have insulin, but it shouldn't be that high. So if you do it and it's high, that is your early warning signal that,
let me just pause you there.
Sure.
Now, in the morning, you said that the insulin shouldn't be high, right? It should be low in the morning.
It should be like normal. It should be low.
Normal
it should be high.
Low. Nobody knows. I mean, I've never heard of an insulin test being done in this part of the world. I mean, I've never seen a doctor who ever asked for get your fasting insulin done. And I think it's because of different ways of assaying it, that different labs and give different results, and it's never stable.
Exactly. Right? That's what they're gonna say. It's not a standardized test and so on. But anybody, you can go, like in your country as well. I mean, if it's physically not available in the country, I know in many places you can have standard. It depends on how aggressive somebody wants to be. But suffice it to say, okay, you might not have access to that test at all, and I understand it because it might be expensive. But you need to just pay attention to how you feel, and also just know what you're eating. If you're eating a lot of added sugar and a lot of refined starches and so on, if you're not feeling as well as you would like to feel, if you have difficulty losing weight or you're kind of putting on weight gradually, right, then you're probably a little bit of disarray. So those are some of the clues, and we can talk about some more of the clues afterwards because they're things you can measure, like your waist circumference and so on and so forth.
Right. So,
but it's a early warning signal.
Sure. So let's talk about because I had a continuous glucose monitor. Which I had on for about 2 weeks to a month actually, and I lost about 8 kgs.
Great.
And doing nothing but just watching what I was doing. I mean, I was shocked that just one piece of bread and the thing will shoot to 8 milligrams. I mean, it just shoots up. The figure 8 comes in. And otherwise it's 5.3, 5.4. So I started knocking off one by one all this stuff, and I found that I was just losing weight. But tell me, in the morning, what happens to the glucose in the morning? What's it supposed to be?
So your glucose system, fasting sugar should be around 100, 90 or 100, right? Certainly not above 110, okay? So in the ideal setting, your blood sugar is going to be range from 70 to 120. It might go up a little bit to 140 after you eat, but the body thrives on a stable number of about 100, 110, just normal for a super healthy person, maybe caveman days compared to now, but that's the normal level, okay? And when we wait, like human beings in general, like everybody gets a little spurt of glucose in preparation to face the day, okay? So in the early mornings, you have a little spurt of the steroid hormone cortisol that gives you a little boost of glucose so that you can get up and do what it is you have to do. In people who have insulin resistance, right, or outright diabetes, because they have the insulin resistance, their spurt ends up being more extreme. So they have a higher surge of blood sugar in the morning because they don't have the insulin working to put it to where it should be. So their fasting sugar might be higher than 126, right? Or for somebody who's really living with diabetes, in the throes of diabetes, And depending on how they're eating, if they're eating a very starchy meal late at night, or they're having snacks and sugars and so on at night, then they're going to sleep with a super high blood sugar, and their body is going to work so hard to bring it down that eventually it ends up coming too low. And so in the morning, so by the morning, it comes too low. So overnight in the sleep, they're producing cortisol, they're producing some of the other stress hormones to bring it back up from that low that it crashed at because of what they ate at bedtime. So there are two potential reasons for blood sugar being high in the morning. But the fact is, if your sugar is higher than 110 in the morning, you have to start worrying. Maybe you're pre-diabetic, maybe you're diabetic.
Oh, brilliant. Thank you for that. Now,
Sure.
there's another, topic of discussion that is really, mind-boggling, and that is cortisol. You mentioned cortisol.
Mm-hmm.
And neuroscientists, have said open and blatantly that cortisol is not a stress hormone. And they've made those statements because we've all brought up in med school and all that stress equals cortisol, and cortisol equals your belly fat, that kind of thing.
Yeah. Yeah.
And yeah, apparently cortisol is more of an energy producing hormone. It gives you your energy. So
Yeah.
clarify that. I mean, you're a specialist. Where does cortisol play in this? Because in the morning, I'm talking about blood pressure,
Yeah.
they always say don't take a blood pressure in the morning because the cortisol is high and you're going to get your
Yeah.
pressure. So
Yeah.
yeah, give us some light there.
I mean, I guess you can. I haven't heard anybody say it's not a stress hormone, it's an energy hormone, but it makes complete sense, right? Because yes, I mean, cortisol has so many functions in the body, but in terms of what we're talking about with energy hormone, if you are under stress, and the classic, like from, I guess, Paleolithic days or whatever, old time days when human beings were exposed to a lot more physical stress events, right? So yes, you need energy to escape from whatever the threat is. So maybe that's why they're saying it's like an energy hormone, right? Because when you're, or if your sugar goes low for whatever reason, like somebody who maybe takes too much insulin, or if you're hungry, like you go too long without eating food, so you're gonna have the event where your sugar drops. Cortisol kicks in so that you can make sugar, so that you can have the energy you need to stay alive. So maybe that's one way of looking at cortisol as an energy hormone, right? But in terms of stress, physical stress, yes, classically, but in our modern times, what we're faced with more is emotional stress, right?
Absolutely.
And emotional stress, unfortunately, is read the very same way by our brain as physical stress. So it's going to produce the same cortisol to give you the energy to fight or flee, but it's only that now with emotional stress, there's nothing to run away from or fight. So you basically, as I like to say, you fume in the cortisol and the resulting sugar that's produced, right? But then another thing too is overlooked, because a lot of people know, okay, stress, I'm under stress, I'm anxious and things like that. But also there are like medical reasons for stress, right? So people might have chronic infections. Of course, as an infectious specialist, I would see the chronic hepatitis B, hepatitis C, even HIV, chronic fungal infections, chronic viral infections, other viruses. So some of those infections they're chronic, smoldering under the surface, but they're not going to cause you to have fever or to feel sick per se until it's at a late stage. But that stress from the chronic infection is causing, excess cortisol and sugar production and so on, right? Somebody might have chronic stress because they have chronically low levels of oxygen, either because they're a smoker and they have emphysema and scarring of the lungs, so they're just not giving themselves enough oxygen, or maybe it's at night, they have sleep apnea, obstructive sleep apnea, where they have multiple pauses of breathing throughout the night, where your oxygen is dropping multiple times, your carbon dioxide is going up multiple times, you're waking up multiple times to get your levels back up, right? And so that chronic stress every single day also will cause you to make cortisol, but you're not running anywhere, but it's causing your sugar to go up. And eventually, too, with that chronic cortisol production, you're going to see the effects. We know there's a disease, you as a doctor as well know, Charles, that there's Cushing disease and Cushing syndrome, where the body, the gland, overproduces above the kidney, it overproduces cortisol. And the classic manifestation of that is weight gain, but the weight is distributed in a particular area. It's in the truncal area, so around the belly, behind the neck, right? But classically, cortisol causes the fat storage in the belly area within and around the organs. Right. And it's just one of the things we see.
Okay, so let's just stay on this flow. and you talked about let's say someone goes on a very strict sugar-free diet, right? And let's say we're talking about fasting. I mean, there's so much in the literature about intermittent fasting
Yeah.
and trying to get your sugar down or get your weight down and all that. Um, Before we touch that, I want to take you back on this HbA1c, which is a 3-month average.
Mm-hmm.
Now, I've been to the doctors for how many years? I can't remember how many years I've been getting my bloods checked. Talk to us about being a pre-diabetic. How long can one stay as a pre-diabetic before full-fledged diabetes comes in?
So you can stay as a pre-diabetic indefinitely. And by the way, pre-diabetic, that term is kind of one of my pet peeves. I don't really like it too much because I think it's
I will tell you, it's a false it's a false hoodwink to tell you that you're fine, because when I go and get my HbA1c, it was high recently, 6.2 or something like that.
Yes.
And the guy tells me, it's okay, Charles, you just watch your weight, and that kind of thing.
Yes.
But one day it's going to go haywire and the pre is going to fall and drop.
Yeah. Yeah. Or it might never, right? So the reason why that A1C is the pre-diabetes diagnosis is so misleading is that it makes you think, right? It totally disconnects or ignores what's going on behind the scenes, what's going on under the surface and the root cause. So It just makes you think, oh, like my sugar's a little high and but it's not diabetes yet and I don't need medications yet. But the fact is everything is happening under the surface that's causing your insulin resistance, right? And somebody can even have not even a pre-diabetic range, right? But you can have normal blood sugar levels, but your fasting insulin is sky high. It's like 15 or 20, right? So your body, because all of us are totally different, and some people's bodies are very good at keeping everything together, right?
Yeah.
Keeping everything looking good and normal, right? And some people
I don't like them.
with that. What's that?
I don't like them.
No, but that is probably a bad thing, right? Because they're not actually getting the warning sign unless they're going to check their fasting insulin. They will never know, right? And we see this in the hospital all the time where somebody comes in, it's usually a man, but sometimes it's a woman, and they come in with an awful heart attack or a stroke. And then the spouse is there saying, oh my goodness, like he was never sick. He was working, he was doing fine, he was totally normal, doing everything, right? And then we do all lab work and we find all these abnormalities, especially things like high triglycerides and maybe the pressure is high. So all these things, abnormalities we pick up, but because their body was very well compensated on the outside, they never knew, right? And if you're eating what everyone else is eating, these things, depending on your genetics, right? These things can be creeping up and happening behind the scenes, right? So that's why pre-diabetes, that term is very misleading, falsely reassuring as well, because a pre-diabetic has the very, 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 very same problem as a type 2 diabetic, which, by the way, when these medications came out, Ozempic and so on and so forth, people getting upset that overweight people were using these medications. And I said, look, overweight people have the same root problem, which is insulin resistance, as a type 2 diabetic. And so if you're going to take a medication that is going to help in some way, right, at least temporarily until you can do the things, lifestyle, right, but it's getting at that root cause, which is shared. It's a spectrum. It's like a continuum, right? So obesity, pre-diabetes, even high blood pressure, high triglycerides, fatty liver, all those things share the same root cause, which is your insulin is not working properly. It's too high. And then you can have insulin high because it's high enough to squash the sugar down, right? But it's working super hard and eventually it can falter. It fails. And this is when we see people coming in with a bad heart attack or an awful stroke, and they're basically hanging on for life in ICU because now after a while, your body cannot contain everything, anymore. It can't contain it.
So insulin seems to be the real the trigger that kind of keeps the whole thing on a cascade, one after the other. And so, this is godsend. I love talking to you. I wish I was your neighbor. How do you stay so nice and trim and
Well, I'm not going to lie, that part of it is probably genetic, but honestly, over the past 7 years, as much as maybe my family, it's obesity is nothing, but really my husband and I, and well, we have a son now, but we are obsessed with just eating as healthy as we can. And when I say healthy too, I don't mean, I basically mean we're obsessed with eating food that's as natural as possible, okay? And so we're in a small town, we're not in a big city with all the fancy things, right? But we focus on getting food that is as close as possible to the land or the sea. And we really go out of our way to avoid as much as possible those overprocessed foods, right? Those overprocessed foods are what are killing people, in my opinion, okay?
That's added sugar.
They have added sugar, but not even added sugar, because that's another trap for a lot of people where there's no added sugar. They're like, but it doesn't have any sugar, right? But it's refined starch, processed starch. And starch, like you talked about bread, you would eat bread, 2 slices, and your sugar shoots up, right? Because or starch is basically, it breaks down to pure sugar. Whereas sugar, right, is 2 sugar bonds, 2 sugar molecules, like if you think of a train, and so you have fructose and you have glucose, right? But starch is just pure glucose bonded together. So you have a string of glucoses, so to speak. And when you eat that starch, that bread, the bonds split and you have pure glucose in your system. So in fact, bread, especially white flour bread, is going to shoot your blood sugar up higher than table sugar, right? Just because table sugar has 50% glucose and 50%, fructose, right? So it's just the fact that these foods are processed. When you take them in your body, they're easy to break down. So even if it's not sugar, it's a different form of sugar, and it's a lot of times not coming with enough protein or enough healthy fat to offset the amount of starch or sugar that's in it. So it's imbalanced. It's one-sided.
Right. Okay. Well, there's a lot in the literature now focusing on fructose as the real culprit for metabolic disease or mitochondrial dysfunction.
Yeah.
And we hardly think about fructose all the time because glucose is the one that comes to mind all the time. So what's your take on fructose? And how do that's on syrup, right? Anything that has to do with syrup.
Well, high fructose corn syrup, especially, you would see on food labels, or just you might see corn syrup. But usually, if it has some kind of corn syrup in it, then probably it has a higher concentration of fructose than normal. Table sugar, like I said, is approximately 50% glucose, 50% fructose. But if it's a high fructose corn syrup, it's going to have a higher percentage of fructose, like maybe 70, 80%, maybe 90, depending, right? And the thing about fructose is that whereas glucose, right, can be taken up by all the cells of the body, fructose can only be processed by the liver. So fructose is exactly like alcohol. Alcohol is another substance that can only be processed by the liver, okay? And so if your liver, you're having your high fructose corn syrup is usually in juice drinks and sodas especially, but some foods have it, snacks have it as well. But if you're having lots of those things constantly throughout the day, it means that you're sending your liver a lot of fructose throughout the day. And this is pure fructose, because some people would say, well, fructose is fruit sugar. Fruits have fructose, right?
Yeah.
But fruits have fructose with an antidote, and the antidote is fiber. So if you're having it with fiber, then it's not flooding your liver all at once, because in amongst the fiber, the body has to work to get at it. And so it's a slower release to your liver rather than just all at once, like from a soda. So yes, fructose, for that reason, high fructose corn syrup and in any of those processed things, you're going to want to be very cautious about it, because it's just like drinking alcohol and without a healthy liver, you do not have a healthy body, because the liver is king of keeping your body nice and clean and keeping everything functioning.
This is God sent, because it's really cool to hear you, and thank you for all that
you're welcome.
Telling us. But I want to go into an area where I've struggled with, and I'm still struggling, and I know a lot of people are struggling with it too, and that is belly fat. And when I was reading your book, and you talk about brown fat, white fat. I never heard of white fat. I do liposuction, okay? It's all yellow. It's all yellow, okay? And the moment I do a tummy tuck and open it, there you go. You got all this yellow bubbles. I call it yellow birds jumping at you. Now, brown fat is important for energy, right?
Yes.
Belly fat is white fat.
Yeah, and you're right, it's yellow, because I see this fat too, right? When we have these big wounds that have to heal, like secondarily or whatever. So I don't know why they say white fat. Indeed, you're right. But anyway, brown fat is basically it's protective for babies, especially. And maybe people in temperate regions. So there's like in winter zones, right? So brown fat is a type of fat that really generates heat. It's like the internal furnace for the body. And babies have it because babies can't shiver. They're like underdeveloped and they don't have muscles and so on. So they can't shiver and generate body heat. So protective wise, like nature, this is nature's way of having babies kind of stay alive and stay warm, because temperature is one of those constants. Just like glucose, temperature is another constant for proper healthy body. And so babies have brown fat, but then once babies grow and their muscles develop and they start being able to shiver, so by the time they get to be 1 year and so on, and they have muscles that can shiver, they can generate heat, they don't need that brown fat anymore. So it kind of recedes, and you might have just a little tiny bit behind the breastbone. People who live in icy, wintry areas, when they do studies, when they look at like scans, MRIs or whatever, and they see that, hey, in the wintertime, the amount of brown fat is higher compared to in the summer, because, hey, this is the internal furnace to keep them warm. But the thing about brown fat versus white fat or yellow fat is that brown fat actually has a higher concentration of those same energy powerhouses, mitochondria, right? And so where there's a lot of mitochondria, there's a lot of energy use. And when there's energy use and all these reactions, then you have heat production, right? And so muscles also have a high concentration of the mitochondria, which is why having a bigger bulk of muscles means that you're going to suck more energy in. You're going to suck more of that sugar from the bloodstream. So people, there are different hacks that you would hear about on the internet. And one of the fancy hacks over the past few years is people getting into the cold baths, right? Going into cold rivers or whatever, because doing that every day rather than living in a temperate area. But if you can do that for some amount of minutes every day, then it makes your body make more or stimulate the production of more of the brown fat, so that you can shiver and keep your body warm from within, right? So that you don't die from hypothermia. So it's just one of the hacks to have more brown fat. Like you would have seen in the book, like I talk about the fact that, okay, not all of us like the cold like that, but there's some foods maybe that can potentially help with stimulating a little brown fat, cayenne pepper, just because when people eat chili peppers, they sweat. So that's an indication that it causes like heat production and energy burning, right? And like green tea, other hot things, peppermint, clove oil, ginger, right? Those are little hacks. I don't like to necessarily tell people go and have all these things, because I don't think there's like a one simple fix. I think it's multiple things together, right? And we might talk about the B.E.A.M blueprint, but basically a lot of what trips up a lot of people is just thinking that, oh, I'm going to just do this thing. I'm going to do this hack. So for some people it might be, oh, I'm going to do the cold plunges, and that might work, right? But I think all in all, if you do one thing, but then you still have a lot of other negatives coming into your body, like especially the food, then like one good thing is not going to balance out or cancel out all the negative from the processed food. So brown fat helps because it helps to, and in fact it talks about how, because brown fat burns a lot of energy, right? And white fat is there as energy, backup energy. You can think about your burn fat cannibalizing the white fat.
Okay, so if I'm going to now start controlling my sugar and really be serious about it, there are some people who talk about dopamine fasting. And I'm not sure whether you are familiar with that. But if you're going to burn up your belly fat, what's the way to do it? I mean, come on, give us a concoction for that.
Well, I think it's not going to be an overnight fix for sure, right? I don't know if I wouldn't say it has to do with dopamine fasting. Dopamine fasting, I'm going to guess that has to do with just staying away from pleasurable things. That's it? Yeah, well, yeah. But in terms of the belly fat, it's going to be multiple things together, right? And one of the big ones is going to be eating in a way that keeps your insulin down, right? Also, well, the first thing is looking at stress. Like, look at all the different potential stressful things in your life. So I like to tell individuals, hey, like, let's check. If I'm not their doctor, then I like to encourage everyone to just kind of get a general check to make sure there's nothing chronic, nothing untreated, right? Undiagnosed in their system, an infection. Look at sleep apnea. If somebody is overweight, they might need to get the sleep apnea checked and get it treated, the machines and so on, until they can lose weight and then get it naturally taken care of, right? But in terms of the belly fat, you're going to have to look at what you're eating, okay? Before I talk about food, I should talk about building up or considering building up other areas of the body that will burn energy. Because if you have tissue right there at rest, those tissues are going to be burning energy. So muscle is a big one, right? Focus on protecting all your other organs as well, because when you have healthy organs, it means that you have enough healthy tissue to burn the energy that's coming in from your food. So look at those. Maybe, you know, whatever you can do to build your muscle, right? But it's going to come down to the food and looking at eating things that are not going to rapidly carry up your blood sugar level. So you're going to have to do more of the protein, right? More of the fat, more fiber, more things to dilute the amount of sugar that you're getting into your system. And if you're eating sweet things, right, you might choose sometimes to eat sweet things, leave that towards the end of your meal so that your system is already primed with all the other things that will kind of dilute the sugar.
Yeah. Okay. Well done. And we've covered a good number of topics over this conversation. And I want to zoom back on your book because, and I hope all those are listening in to try and get this book called Beaming Health.
And I think
B.E.A.M. That's the blueprint. So
this is it right here.
There you go. Yeah, Beaming Health. There you go.
Yeah.
And so B is burn more sugar.
B is burn, so burn more sugar. Okay.
E is eat less sugar.
Yep.
A is absorb less sugar.
Yes.
And M is make less sugar.
Yes.
So less is more.
Less is more. Less is more to an extent, but less of what, right? So you want to have more, because I don't like to focus too much on restriction, because I think that trips up a lot of people. You want to have more of those foods that come with a lot of nutrients, right? So not just like plain heavy on the starch, because you're not going to get much nutrients, but you want to have those rich foods that have protein and they have fat. So in your meals, your peas and beans, those are going to have a lot of fiber. They're going to have protein, right? They're going to have a little bit of fat as well. If you have a lot of nuts and seeds, again, they have some starch, but they're going to come with some protein. They're going to come with fat and fiber and a lot of nutrients, right? So you want to get those foods that have some color, they have some texture, because that makes you see that, hey, I'm getting a lot of nutrients from these compared to something that's kind of plain and in the like from a factory, right? But less is more in terms of those things that didn't really come from nature. They are far removed from nature.
You know, we live in a country where it's all about, I mean, I love my curry, you know, there's rice and curry and all that. Yeah. And so everything here is on noodles, this, noodles, that. Yeah. And, you know, it's tough. E is really tough, eat less sugar, because every damn thing here is full of sugar. You know what I mean?
Yes, you're right.
Carbs is so high.
Yes.
And so, you know, I think at the end of the day, it's all about your mindset and, you know, getting tuned to where you want to go.
Yeah, Charles, it is about mindset to an extent, right? But also too, you know, you have to, because those foods are there, the curry, the noodles and so on. But if you start realizing that, oh, maybe, okay, I'm not going to cut myself totally from these things, but it's imbalanced how I'm having it now. I'm having way too much noodles and breads and so on compared to the other things. So we said less is more, but then if you kind of think about it in another way and say, hey, I'm going to add in more things with whatever the starch is. So I'm going to go out of my way to have more meat. I'm going to go out of my way to incorporate more vegetables, right? I'm going to go out of my way to have more, you know, fat, maybe butter, or I don't know how much tallow and things like that, olive oil, right? Incorporate the use of more fatty things in my meals, right? And a lot of times too, you might think, you know, the audience in general, that, hey, you know, I don't like vegetables. I don't like nuts. I don't like this. I don't like that. And I like to tell those who I work with that think of yourself as a baby, okay? So when babies are born and you're feeding them formula and you're trying to now wean them onto normal food, they don't want to eat it. Like they're going to turn their head, they're going to spit it out and so on and so forth. But we don't stop giving them and just continue them on formula and milk forever, right? We keep giving them these new foods. We try different types. We find different ways to prepare them. And we do it and do it and do it until eventually you have a child who's eating normal food. They're toddlers, the same thing, but you keep trying different ways, right? And so for adults, I think having been maybe for most of your life eating a certain set of foods, you have to think of yourself now as a baby being weaned from those foods that you're accustomed to and onto the foods that are going to support your health, okay? And that's, if you think about it like that, and realize that you're not going to like it immediately, number one, right? Number two, you might not like it in this way, but you might like it in that way. And you keep at it like a baby. And then to realize that the taste buds have an amazing ability to change and begin to dislike certain things, such as sugar, right? If you wean yourself off and then get to like other things. It's an amazing thing.
Well, this is fantastic. Well, we've come to more or less the close of this conversation. I mean, it's been an hour with the one and only
Wow, it's been
Dr.
so long.
Amina Goodwin. And
Wow.
so how do people get your book, and how do they reach out to you from the podcast? How do they get to you?
Yes, thanks for asking, Charles. So the book is going to be available officially on February 6th. That's the launch date of the book. So the website will be beaminghealthbook.com. But for January, from that time as well, it's actually going to be available on Amazon. And we're going to have a special on it for the first 3 days after that launch, February 6th, 7th, and probably 8th, where it's going to be available at a specially discounted price. So I encourage everybody to get the book. And it was written in nice, easy language. It's not a big book, right? So I didn't want it to be one of those thick books with loads of references. Just to the point, no fluff. And essentially, I wrote it for my for the patients that I have on a day-to-day basis, where you can't tell them everything in a 15-minute visit or whatever, right? But this is to have as a resource that you refer to. We have diagrams in it as well, so you can put in pictures. A picture's worth 1,000 words. So it's really that handbook to get you understanding as you get on the road to mastering your health, mastering your blood sugar, mastering your health. Because a lot of times you know what to do. The audience out there, everybody, all of us, like even me before when I was using sugar, like we know what to do, right? But you don't do it, okay? And so to start doing it, you become the person who can do it. And then you keep practicing and maybe getting guidance from others until you get on that road to mastery. And when you're a master now of sugar and your health, right? Sugar is not dominating you. You are dominating sugar. You are a master of sugar. So that's what right. My goal is with, everyone who I come into contact with.
Wow, that's beautiful and well done. And once again, congratulations on this book. I think
you so
at
much.
the end of the day, the two things I got out was choose your dance club, because all the sugars dancing in different clubs and all that.
Yes.
Either you have a foxtrot or a jive or a waltz, so choose your dancing partner. That's the other thing.
Yes.
Choose your dancing partner, and then make sure that the bouncer, which is the insulin, be careful of that one.
Yes. I didn't touch too much on that in this talk, but if people get the book, the audience gets the book, they will see what we're talking about. But yes, choose your dance club.
I know, that's right. Well, on that note, I want to say thank you very much for this wonderful conversation. It certainly helped me a lot. It's educated me in many ways, and to be really focused on staying alive. I used to go I had a gym. I had a what do you call it? A trainer that I had engaged, and she would, every time before she starts off, she would shout out, "Charles, don't die before your death."
Yes.
And that was a stark reminder that is, why die young? You know what I mean?
Yeah, indeed.
And I think what you're doing is, and I want to close with this, what you're doing is, there's this Robert Boyle. He was the father of chemistry. And, in school, we used to learn the Boyle's apparatus and the Boyle's law. So Robert Boyle, and he wrote a 24-point wish list that this is like 350 years ago. And so he wrote these 24 points out, and you can Google it, Robert Boyle's wish list. The top two were, number one was the prolongation of life. And number two was the recovery of youth. All right. And so what you are doing, really, this book is bringing out the top two of what he was talking about. How do we live longer? How do we increase longevity? And if we know that there is a terrorist, I call glucose and all these problems biological terrorists.
It's true. I like that. Biological terrorists. I'll remember that. I'll steal that from you, Charles.
Take it, because whenever I talk about oxidative stress, and that's how I ended up with open heart bypass surgery, was because stress took a good part of my life. And emotional eating, emotional this, and everything to do with emotion. I mean, the brain is the real, be the boss of your brain, is one of my Dr. Selena Bartlett talks about. But at the end of the day, this is important. These are biological terrorists that we have to capture and get it out of the system and keep it in check
Yes.
for us to live a healthy life. So on that note, thank you once again.
Yes.
Love your work. And once again, I hope everybody buys this book so that we
Yeah.
all have the health that we deserve. And it's a disease, it's a lifestyle that we can control. And
Yes.
and this is something. So for those of you who have tuned into Heart Talk, we are talking about the good talk of how you can control glucose and how you can avoid becoming a diabetic. And there are a lot of goodies in this book. It's Beaming Health. It's available from February. So stay tuned, stay in touch. I'll leave all